myself, my Dr. Sheetal. Welcome to my YouTube channel UC Medico. I am here to help you and guide you for your upcoming examination INI-CET November 2022 and NEET PG 2023. Well, I'm not feeling well, so the session will be a little bit of 30 minutes or 45 minutes kind of, not more than it. And few things which I'm getting from your side, that is about the 20th notebook. Like, comment down in the section that I have to make a video on 20th notebook or not. Then I will give you the right suggestion. Otherwise, DM me on the channel. Okay. So in this video today we are going to discuss about the few IBQs and one or two important things for the upcoming INI-CET examination. First, remember, you have to read in detail about NGU, because the last year is the question about the NGU, that is non-gonococcal urethritis, and few images like about micaceous scaling or Brany scales. Okay, because the previous exam there is only written in the words, not the image, so be ready for the image based. Okay, let's start the session. Few important things and how to diagnose this. That's it. Such a cute color, कितनी सुंदर लग रही है, looking so beautiful. White hair, decreased melanin pigmentations, white eyebrows, white eyelashes, but here you can see this, the difference in the eyes. Making a spectacles now. Okay, let's erase this. Just focus on her studies. She looks cute on spectacles, right? Okay. Let's focus on study again. The patient is of albinism, where there is congenital absence of the pigmentation. In albinism, when there is a pigmentation absent because of the absence of the melanin. One more important thing I want to say is, there is a disorder related to this in the biochemistry. Please comment down in the section. Okay. From which enzyme deficiency this is going to be happen? मुझे पता है. Don't worry, I know the answer. Let's comment down in the section. Okay, let's again continue. So the patient is of the albinism, where you find that there is absence of the melanin pigmentations, and here you can see the difference in the eyes. The reason behind this, because of the pigmentation, you know about the retinal pigment epithelium. Okay, retinal pigment epithelium, that means there are pigmentation are present, but in albinism, when there is the melanin absent, how will get our retina get pigmentation, right? That's why the pupil and the iris both have lack of the melanin and lack of the color. Here the condition, when there is a difference in one eye color with the other, it is known as heterochromia iris. What is known as heterochromia iris? Let me write down. Heterochromia iris. Sometimes what happens, that there is a difference in only the section of the eye. Here is iris, and only this section is different from the other section of the same eye, that it is known as iridis. Iridis. You can remember from the this means section. Okay, and the other one is the iridium. Here is the iris. When you see there are multiple color, multiple pigmentation in the iris, this is known as iridium. in marrow you will find some kind of a questions. Okay, so iridis, there is a question in the marrow also, that iridis is the side effects of which drugs? That is prostaglandin. Okay, that is prostaglandin. Okay, there is a cute girl with white hairs, white eyebrows, white eyelashes, difference in the iris, congenitally present, albinism, and the deficiency of enzyme is tyrosinase, and this is due to the deficiency of the copper also. Okay, so I give you around 3 questions in the same pics. Let's move towards the next question. Yes, what you are going to see here? Let's wait a minute. Yes. He has pigmentation, right? That means melanin is present, but at some part the color is not present. That means melanin absent. So this is known as the pyabaldism, and when eyes are also involved, that is known as white forelock syndrome. Okay, white forelock, like a section from hairs are some parts of the hair involved, and some part of the forehead involves with something you find it islands. These are called as islands because these are the normal melanin pigmentation, where you found these hyperpigmentation with normal pigmentation, right? These are the hyperpigmentation with the normal pigmentation. This is known as the pyabaldism. You can remember this with also, that is BAL, बाल. ठीक है. In Hindi language we used बाल word for hairs. So when the hairs are involved, and let's do something new. This is our pie cake. ठीक है, cake. We take a pie from this side. Pie. Pyabaldism. Okay. Let's move towards the next image. This is the hyperpigmentation, only one part. Nevus acromicus. There are 2 types of nevus, nevus acromicus and nevus anemicus. In anemicus there is vasoconstriction, while in acromicus there is actually a absence of pigmentation, true absence of pigmentation. Let's move toward this era. On dioscopy, what we will do in dioscopy, we will take normal slide, like in physiology and pathology we make slides, no? These are that kind of the slides, and we compress that slides on that the pigmented area. Then we'll look that the margins will moves apart from on compression. When this will not happen, that means it is a truly there is absence of the pigmentation. When opposite this happens and margins becomes deranged, that means this is due to the vasoconstriction, because excessive vasoconstrictions leads to the decolorization of that part. Got it? This one is the nevus anemicus. This is pityriasis versicolor, when there is a hair follicles involved. Okay, these are the hair follicles. The area around the hair follicles are present with some kind of itching will also present, and some kind of scales are present. These scalings are present only in itching. Okay, so these are known as purpuraceous scales or briny scales. These are the questions. Okay, here you can see that there are some small follicular areas are involved. This is perifollicular areas. Okay, क्या ना पेरिफेरिकुलर एरियाज जो आपका इन्वॉल्व हुआ है, तो इसमें क्या है, जो कि ना हेयर्स जहाँ से निकल रहे हैं उसका आसपास का एरिया. ठीक है, उसका आसपास का एरिया वो कौन सा हुआ, फॉलिकल्स के अराउंड, दैट इज पेरिफॉलिकल एरियाज. दिस पेरिफॉलिकल एरियाज व्हेन गेट डिग पिगमेंटेशंस, and this is usually tinea versicolor, also known as tinea versicolor, due to the fungal infection. You can see this. Okay, fine. These are all the images of the hyperpigmentation. Then we go towards the hyperpigmentation. Okay, this is such a clear hypopigmentation with a round circle, and there is some small satellite like lesions. ठीक है. The clinical questions will be like this, giving you some hint about that the patients belong to UP, Bihar, and okay, जो कि हमारा epidemic region होगा, और leprosy. These are the areas. So various kinds of like in Hansen's disease we known as that leprosy also. Okay, don't forget this leprosy. Borderline tuberculosis, borderline lepromatous, borderline tuberculosis, and tuberculoid type, and lepromatous. These are the types. We will doing it later. Yeah, ठीक है. So these are the lesions. Borderline Hansen's disease or post-Kala azar dermal leishmaniasis. What is the difference between these two? Post-Kala dermal leishmaniasis, there was a history of the prolonged fever, like 1 year, 2 year in the endemic region. Almost क्या है कि the endemic region of both is similar. Okay. Now look towards this. This is borderline tuberculosis. Borderline tuberculosis, there are many kind of white patches. You can see this hyperpigmented areas. Here we are seeing large type of hyperpigmentation. But in PKDL, post-Kala azar dermal leishmaniasis, because it also known as Kala azar, both kind of lesion scenes. It can be hyperpigmented or it can be hyperpigmented. But there will be a prolonged history of the fever, suggesting of the Kala azar. Normal sensations, yes, normal sensation, no nerves involved, no scales are involved. In leprosy, there is nerve involved, but only in multibacillary, not in paucibacillary. When there will be any question when it's suggesting that there is nerve involved and suggesting you like it leprosy, go toward the multibacillary option, not towards a paucibacillary option. Remember this thing. Okay, let's go towards the next image. There is something in these two images. I am going to add one more thing else. Okay. Yes, indeterminate Hansen's, indeterminate leprosy are such kind of a leprosy which we cannot determine what kind of this leprosy. It's almost looking similar to other hyperpigmentation disorders, but in indeterminate Hansen's disease there is only one pigmentation, like with normal sensation, usually जो child present होगा with normal sweating, but there is atrophy is present. Okay, this is an important line, that there will be endemic area in the history like UP and Bihar. Okay, east side area हो गया. So these will be going to be mentioned in the question. From that we are going to decide whether it is leprosy or some other disease. Okay, so in the clinical scenario when there is a kid present, okay, with normal sweating, normal sensation, but mild atrophy is present. Okay, atrophy is present, not necessary that atrophy is present, atrophy can be present or not present. Okay, atrophy is present and endemic areas, then it is indeterminate Hansen's. Then pityriasis alba, normal sensation, normal something, but fine scaling. The only difference is here is fine scaling is present. When these words will come, then this one is going to the pityriasis alba. Okay, I already told you that in pityriasis versicolor perifollicular areas are involved. Correct बच्चा. जबकि perifollicular areas are involved, we have a face have hairs also, but these kind of hairs are not prominent in girls but prominent in boys. Right? When you look clearly, that you can able to see that so mild circular areas. These areas where hair follicles are present, covering the surrounding area of the hair follicles, and the multiple lesions are present. These lesions are present with itching and fine scaling. So it all suggestive of the pityriasis versicolor with briny scales or perforaceous scales. Okay, note down this point. This was your question also. Briny scales or perforaceous scales. Yeah, I know that sometimes in English it being so boring lecture, but the reason is that I'm more comfortable in Hindi, but I'm trying to improve and you will also enjoy. The important thing which I want to say with all to you, that kindly look for the images on the daily basis till that it become यू बिकम हैबिचुअल टू इट, दिमाग पर छप जानी चाहिए. तो इतना होना चाहिए कि बस देखते हाँ ये इस चीज़ की इमेज है. नो मैटर यू रेड द क्वेश्चन और नो मैटर यू डोंट रेड द क्वेश्चन, जस्ट बाय लुकिंग एट द इमेज योर ब्रेन से click and you got the answer. Okay, let's move towards the next image. Vitiligo is pigmentation, hyperpigmentation. Okay, it is also involved in the hyperpigmentation, and when you will see this pigmentation is particularly involved a segment of the body part. When I will divide the body into two half from the midline, then I'm going to realize this is present only particular in this half of the portion and particular in a segmentation line. That's why it is known as segmental vitiligo. These questions are already asked in your previous examinations, so be attentive. Okay, my one of the most favorite leukoderma, take a PTBP, like females using sindoor, kumkum, sleepers images. These are the normal pigmentations. These are hyperpigmentations due to the allergens, rubber sleepers. And sometimes you can also see the most commonly asked question is of the bindi like area. ठीक है, the female using bindi, मुझे नहीं पता, I don't know what we say bindi in English. Okay, so sorry for that, but this is the area where you found round circular like hyperpigmentation area. This is because of the PTBP. PTBP, para tertiary or butyrophenol, something like that. Okay, I don't remember, my fault, but I want answers from you all. Okay, the most favorite of mine, but I'm not getting a important image here. Okay, I will give you another image. Look at here, reddish appearance of the cheek, also involving the nasolabial fold. These are the nasolabial folds. I'm giving you because I don't know at my time. Okay, these are the nasolabial folds which are also involved. When these are not involved and there is no blood vessels, prominenting blood vessel, this is that is known as SLE. But here is nasolabial fold is also involved, that is rosacea. Clearly seen, clearly. These are the nasolabial folds are involved. You can also see pustules here. Okay. Next image is of acne. Acne containing of 4 stages: comedones, papules, pustules, and a cyst. Here you can see all the images. When any questions image of the acne is given, almost all 4 the stages of will given. This is known as the acne vulgaris. Okay, here you can see this. These are the comedones. Comedones are nothing but the blockage of glands. कितनी अच्छी राइटिंग लिखी है ना, माशाल्लाह. Sorry for that. Such a good handwriting. Look at, these are the comedones, not condoms, comedones. ठीक है. These are the papules. These are pustules. And these are so big in the size. These are the cysts. Stage 1 comedones. comedons. Okay, stage 2 papules, stage 3 pustules, and stage 4 is cyst. Okay. Let's move towards the next stage, acneiformic eruptions. Only one kind of a stage is seen is acneiformic eruption. Acne form like similar to acne. Only one stage is found, most probably of pustules, small pustules, or comedons, like stage comedons. Okay, so these are giving, sorry, okay, when you can say that these are all look similar, but most of the time it is due to the side effects of the drugs, and the most probably because of the NSAID. Remember, dermatology, when they will be asking any questions regarding the drug side effects like fixed drug eruption, aciniform eruptions, and even psoriasis, the most of the time the answer will be the NSAIDs. Okay, this you can see, this one is. Now the next image of melasma. Okay, these are the pigmentations. Mainly happens when there is an exposure to sun rays. That's why we use SPF 25 BB creams, so that to prevent this kind of the pigmentation. When in the question, when three things are the given, any three things like sun exposure and non-pregnant female, most important thing, because in pregnancy we call it as chloasma, and most probably it will be due to the estrogen. ठीक है, हार्मोनल चेंजेस की वजह से here we are saying that melasma due to the sun exposure, hyperpigmentation acquired, and brownish in color. What is your answer? The answer will be yours is melasma. Okay, let's see towards the next question. Yes, what are you going by saying this? Okay, I'm making something for you. The nasolabial folds are not involved. My handwriting के साथ साथ मेरी ड्राइंग भी बहुत बेकार है. ठीक है. Butterfly like rash and made it ना, butterfly like rash and sparing of the nasolabial folds. ठीक है बच्चा, nasolabial folds है वो जो इसके अंदर होते हैं, involved नहीं होते. Nose, our cheeks are getting involved in the acelli with erythematous rash only. There is no telangiectasia, while in rosacea there is telangiectasia. There is no rhinophyma, while in rosacea there is rhinophyma. Let's see. Yes, my most of the favorite images too. Two images are the most of the favorite because there are lots of confusion in this word, that is nevus of aorta. Yes, now you can clearly see the image, nevus of aorta and the nevus of ito. Here you can see a girl with, these are the blue pigmentation, right? These are the blue pigmentations, and when you look towards her sclera will be also be blue. ओके, तो क्या होगा, उनकी स्क्लेरा होगी वो भी ब्लू होगी, जो फेस होगा एक साइड से वो भी ब्लू होगा. आई मीन टू से दैट व्हेन यू लुक टुवर्ड्स सच काइंड ऑफ अ पेशेंट्स, you find that one of the side their face has become bluish in appearance and sclera is also involved. This is sclera, and the side of the face is involved is known as the nevus of aorta, which is present in congenitally. Okay, these are present congenitally when face and eyes. ठीक है, तो these are known as the aorta, nevus of aorta. Here you can see this as most clearly seen, most beautiful image of eyes showing bluish discoloration, and this is known as the nevus of aorta. Yes, sometimes you can see this is not that much of the blue appearance, bluish green. Okay, bluish green like appearance, you can see this, and the sclera is also involved, face is involved, that is known as the nevus of aorta. Next image, first I think we have to done nevus of aorta because of confusion. Let me see. Okay, first we do nevus of aorta. Congenitally present. Okay. This one is also congenitally present, bluish discoloration and present on the back shoulder. In Hindi, we use word peeth. Peeth, you can remember from this peeth, peetho, like Ito. So this is known as the nevus of Ito. With the hypertrichosis, you can see that there is a, you can see this. The number of hairs is more in this part rather than here. Hypertrichosis, bluish discoloration present congenitally is known as the nevus of Ito, like Pito. And you can also remember the पीटना. मतलब छोटे होते ना तो क्या होता है कि ना जब बच्चे स्कूल में पढ़ते नहीं थे ना तो क्या तो नहीं पिटाई होती थी डंडे से, मेरी तो खूब हुई है. तो पीटना इज लाइक पीटो, इसको पीटो. तो यू कैन रिमेंबर दिस फ्रॉम हियर ईटो. Let's move towards this cute baby, but with have some reddish mark, a stain. Okay, दाग अच्छे होते हैं. ठीक है. A stain involving his half of the face, also involving his eye. This is known as the port wine stain. पोर्ट वाइन स्टेन, सॉरी पता नहीं कहाँ खोई हुई थी मैं. तो पोर्ट वाइन स्टेन. हाँ, तो व्हेन देयर इज आल्सो इन्वॉल्व ऑन द हाफ ऑफ द फेस विद द इन्वॉल्वमेंट ऑफ द ब्रेन. तो दिस वन इज नोन एज द स्टर्च-वेबर syndrome. In स्टर्च-वेबर syndrome, calcification are seen. Tram track appearance. This appearance you can see here is known as the tram track calcification. You can call it. This one is the CT. First of thing, most important thing, this is the part of the CT where calcification is seen white. It is CT. The outer area of the brain, that is the bone part, not the fat. Fat will seen white in the MRI, but white bone is seen in the CT scan. Okay. So these are the calcification part seen in the Sturge-Weber syndrome, tram-like appearance, with also that half of the part is also involved having port white stain because of the involvement of the capillaries, and because of the eye got involved also there is a high chances of the glaucoma in that patients. Here you can see this vascular headache, glaucoma, port white stain, nevus, flammus, and tram track or tram line calcification. Leprosy. The most important topic for the leprosy, you have to learn about the what is possibacillary, what is multibacillary, what kind of the vaccines, and how many nerves are involved, how many patches are involved in what is actually called known as possibacillary. ठीक है. And what drugs are used and for how many time period the drugs have to given. So I already told you in above section that there are borderline tuberculosis, borderline lepromatous, and tuberculous tuberculoid. When you are going to read about this, that in tuberculous tuberculoid there is only single lesion, single nerve involved, well-defined borders. Okay, these three features which saying this, this is a tuberculous tuberculoid. Remember for that T represents three. First word, ठीक है. T for 3. Everything going to be single lesion, single nerve, and well-defined lesion. ठीक है. Sometimes you see that the borders are not so clear. When you sing everything well, okay, then this is known as the tuberculous tuberculoid. Second thing is BT. We already see the image of the BT in the above in the past lecture. That is a single well-defined lesion with a small lesion around it, hyperpigmented area, which is known as the satellite lesions. Okay, here you can see this. Let's read that satellite lesions or the few lesions, few non-symmetrical nerve thickenings and non-symmetrical patches. Okay. In tuberculous tuberculate, we already read that single lesion, single thick nerve, and the well-defined borders. When one more thing is going to be added, with single lesion there will be some small kind of lesions also present, hyperpigmented area, small, look like an appearance of the satellite. Then we call it them as borderline tuberculosis. Let's move towards the borderline. Why we call it as borderline tuberculosis, borderline lepromatous? Borderline, it means then we give them treatment, or we are not giving them treatment. So it can move towards the tuberculosis type, and it can move towards the lepromatous. Borderline has ability to going to be changed in tuberculous tuberculate and lepromatous. When it moves towards the lepromatous, that means the condition of the patient is going to be worsened. Okay, while it moves to the tubercular type, it means that the condition is improving. Tubercular type is due to the activity of the immune system. Okay, let's learn about the borderline. You see the punched out lesion, Swiss cheese lesion. एक second, let's see some images first. These are the tuberculous tuberculate. A single lesion, you can see this is a single lesion. You can definitely see that this is the well defined border here. You can appreciate ना border, hyperpigmentation है, and anesthetic part है, anhydrotic है, single patch है. ठीक है, मतलब while in PKDL we say that there is no hyperpigment, no anesthesia, no hyperesthesia. ठीक है, ऐसा कुछ भी नहीं था. जबकि यहाँ पर क्या है, हाइपरएनेस्थीसिया है और स्वेटिंग डिक्रीज है, एनहाइड्रोटिंग है, सिंगल पैच है. व्हेन देयर इज अ सिंगल पैच, इट इज नोन एज tuberculous tuberculate type. When the BT type, you can see this is the large lesion, a big bada lesion, and this is the small lesion. This is small lesion around the large lesion is known as the satellite lesion, and we can see this, we can say that it is a BT type. कौन सा टाइप का हो गया भाई, BT टाइप का हो गया. चलो नेक्स्ट पे चलते हैं. हियर यू कैन आल्सो सी दिस, कितना क्लियरली दिख रहा है ना. द मार्जिन्स आर सो वेल डिफाइंड हियर. यू कैन सी दिस इज द स्मॉल लीजन एंड दिस इज द लार्ज लीजन विद द हिस्ट्री ऑफ द एंडेमिक एरियाज. ठीक है, this is the Swiss cheese appearance. These you can see this, and you can see such kind of irregular margins, but you can see there is well demarcated margins on the inner side. This one is the borderline. What is borderline? Borderline can be changed to the borderline lepromatous and can be changed to the borderline tuberculate. ठीक है, annular erythematous plaque punched out in the center. This is the punched out lesion in the center, giving an appearance of the Swiss cheese. Let's move back again to the table. Here, punched out or Swiss cheese lesion, inverted saucer type lesions. These are the multiple but countable lesions. Okay, inner border of the lesion is the well defined. I told that na कि that you can easily appreciate the how much that is inner border. Let's look at this image again. How much appreciable in this image. While this is so irregular, you can't say that this is a well demarcated, but you can say this one is well demarcated. Okay, गर्मी है भाई. हाँ भाई, लेक्चर के चक्कर में ना पंखा कूलर सब बंद रहता है. चलो लेट्स अगेन सी borderline lepromatous and lepromatous have glove and stocking type of hyperesthesia. This is the most important part. Okay, perfectly symmetrical on the lesions, multiple lesions, you can't count that. There is infiltration nodules will be present, can be earlobe can be present. Okay, normal sensation on the patches, earlobe infiltration, and the tropic ulcers. These are the few findings which are got finding in the lepromatous, and what you found in the borderline lepromatous. Multiple lesions that is uncountable. Borderline has countable lesions while the borderline lepromatous has uncountable lesions. Okay, bachcha, just focus here. Okay, multiple bilateral thick nerves involved. These are the multiple bilateral thick nerves involved. Same punched or Swiss chisel. So how will you going to differentiate between the borderline and borderline lepromatous? Countable and the non-countable lesions. And these are the borderline. These are the different thing. This is a collarate plaque. ठीक है, एनुलर है ना, कॉलरेट स्केल्स एनुलर लीजन जो है, एक मिनट, ठीक है, ये रहा, दिस इज द पिटालिसिस रोजिया इन because these two images are suggestive of the annular lesions. Comparison, we give two or more images for like annular lesions. Here you can see this is the annular lesion. You can see this is the white silvery like scales. Okay, these scales are mainly due to the itching. When patient is present with the complaint of the itching, and this kind of image, you can see this one is the rosacea, and this one is known as the collarate scale. This collarate scale because it forms collar like structure. Okay, first thing, these in pityriasis rosea, the patch first known as Harlard's patch. Harlard patch, ठीक है, this will be the Harlard's patch. And look at here, these are the ribs, है ना, इतनी गंदी ड्राइंग है, यकीन नहीं होता, ठीक है. These are the ribs, this is the chest wall. Then this Harlard's patch है कि mother patch है which give rise to other patch, that is known as the Harlard patch. This Harlard patch will give rise to other patch and forming an appearance of fur-like fur tree-like pattern. These are the fur tree-like pattern, and when you can see this, these patches will grow along the ribs. Okay, these are growing along the ribs. Here this is the ribs, yeah, this one here is the ribs. Okay, so collarate scales was a question in your NICT July 2022. Okay, Mikasha scale collarate. Let's continue with the next image. Here you can see this, there are the multiple hyperpigmented areas. These are the multiple hyperpigmented areas, okay, which actually you won't be able to count, but some students are like, ma'am, I can count this. Yeah, go and count this. Do we have so much of time? No, na. So uncountable lesions, symmetrical almost, that's why known as the borderline lepromatous leprosy. Okay, let's go towards the next image. Yes, this one is beautiful. हाँ, earlobe infiltration, बस ये देख लिया, अपना तो काम खत्म, but still ठीक है. earlobe infiltration, there will be history of the, if there is a history of the endemic areas like UP and Bihar as I told you earlier, then and ear filtration, and these are the nodules like structure which is present. This is known as a lepromatous leprosy, and there will also be, it's depend on examiner, that examiner will give you the history of Glavanus talking like deformity and not, sorry, Glavanus talking like hypoanesthesia. चल रहा है. Let's continue with the next slide. The next slide is about the Leber reactions, but before the Leber reaction, we will going to discuss about the two things, that is multibacillary and the paucibacillary. So wait a minute, na. Now I'm comfortable. Yeah. So, multibacillary and possibacillary. Possi means कम, यानी कि लेस. ठीक है. मल्टी मीन्स खूब सारा. Okay, when you are going to read about this multibacillary and possibacillary, there is only 3 difference in between them. So we have decided on it. Yeah, there are lots of us because of kids, as usual vacations. Let's again focus on the studies. तो जो multibacillary है, in the multibacillary more than or equals to 5 number of hyperpigmented patches, while in possibacillary less than 5. No nerves involved, while in multibacillary there is nerve involved. In AFB, during AFB examination, AFB in acid fast bacilli, you will found the acid fast bacilli. You can here found or not found. ठीक है. But usually prefer the presence of the acid fast bacilli. For them, we give the treatment for the 12 months and the 6 months. 12 months for the multibacillary and the 6 months for the possibacillary. And during the treatment, we give 3 drugs, that is rifampicin, clofazimine and dapsone. I hope you already know these drugs. Let's see one unanswered question. क्या क्या चलता रहता है भाई. Wait a minute, कहाँ गया? Here. These are the kits which you're going to see here. In your examination, you are seeing these kits. These kits was given in that question. This pink color, see. Okay, these are the multibacillary, and the green one is for the possibacillary. Multibacillary is for pink for the adult, and here is blue and the brown. The brown multibacillary and the blue for possibacillary, these are given to the child. ठीक है, less than 14. ठीक है. These are the 4 kind of kits. For possibacillary and for multibacillary, the doses are different in the adults and the children, and the most important thing is that the duration is also different. For possibacillary, I already told you that is 6 months, and for the multibacillary for the 12 months. Let's move towards our slide. Here is the lepra reaction after giving the treatment. ठीक है, that is multi-drug therapy. When giving the treatment, you find that there is patient will complain with some changes like inflammation of the existing lesions, but without fever, and inflammation of the neurons. ठीक है, this is type 1 reaction, which is actually a type 4 hypersensitivity reaction. We usually remember this from the 1 plus 4 equals to 5 and 2 plus 3 equals to 5. That's why we say this, that type 1 show type 4 hypersensitivity reaction and type 2 will show type 3 hypersensitivity reaction. In Hindi, we usually say this, that फर्स्ट फॉर पहले, जो पहले आता है ना. ठीक है, तो पहले मीन्स जहाँ पे पहले से वो लीजन प्रेजेंट हो और वहाँ पे ही आ रहा. द लीजन्स again appears, or मतलब inflammation is again appears on the existing site. This is represents the type 1 lepra reaction, while in type 2 lepra the inflammation is present somewhere else, like most commonly on the face and the extremities, especially on the lower extremities. In the type 2 lepra reaction, there will be fever present, and other kind of inflammation, like with the joint inflammation, with the testicle swellings, uveal tissue inflammations, glomerular inflammations, lymphadenopathy, and many other things. While I told you that both are reactions occur after MDT, but sometimes happens that type 2 lepra reaction may occur before the completion of the MDT or before MDT. Okay, let's see. These are the, here you can see this, no? These are the inflammation and erythematous margination are seen. These are the tender erythematous plaque. Okay, these are the plaque tender. Here you can sheen of the tibia, the most common site for the tender erythematous nodules. These are the nodules. You can see this. These nodules are present and tender in nature. Both the things are the tender in nature, but there is only difference. In type 1 there is only inflammation, while in type 2 there is nodular inflammation. Okay, I hope you get my point. Next slide. These are the erythematous nodosum and these are the erythematous induratum. ठीक है, present on the shin, no ulceration, then it is erythematous nodosum. When it ulcerates, okay, when it becomes ulcerate, it is induratum. Look here, this is ulcerate and here is scarring is present. Okay, and the question is about the scarring is that it is primary lesion or the secondary lesion. Wait a minute. The scarring is secondary lesion. Okay, scarring हो गया, scratching हो गया. These are the secondary lesions. Now back towards the look at the lesion here. So what is going on? That there is skin involvement, there is mucosa involvement. ठीक है. Ulcerates. These are actually, there will be a flaccid bulla will be there. Here you can't see this. There's a flaccid bulla. On the peeling of the skin, these are you are seeing these erythematous lesions are present. And when both condition is present together, when there is dermal inflammation and with the dermal involvement with the mucosal environment, it is known as pemphigus vulgaris, because this is due to the desmoglein 3 involvement, and this happened due to the desmoglein 1. In vulgaris, we say that is most commonly involved is 3 than the 1. When there is only the 1 involvement, then we say that is pemphigus foliaceus. Okay, you can see this 1 with F. Okay, 1 डंडे इधर, एक डंडे इधर. Wait a minute. हाँ, अब सही. तो pemphigus foliaceus. Here this image is about the pemphigus vulgaris. Look at this image. Okay, lips, these are the mucosal area, no? The lips are involved, the skin are involved, no targeted lesions, no. Here you can see this, there is no black necrotic area. You won't able to see the necrosis. Okay, these are the skin with the peeling of the, because of the peeling of the skin. Starting they will found that the bullous presentation or papillus squamous presentation. Due to which vesicles, not bullas. Now I am saying it wrong. Bullas are big. Okay, because of the flaccid blisters are present. So this is the pemphigus vulgaris. In pemphigus vulgaris, when you do direct immunofluorescence DIF, you see fishnet appearance. I have that also. Wait a minute, let me see. This नहीं है. एक सेकेंड. Look from the then I will show you from the Google now. Let's see from the Google. Okay, look at this image. Okay, you can see this giving an appearance of the fishnet. Here you can see there is vesicles or bulla is present. Okay, Let's again move towards the image. Yes, histopathology of the pemphigus vulgaris. Here you can see this, there is large space is created between stratum basal and stratum spinosum. Okay, this is the layer of the stratum basal, and this line you can say this, these are the dermoepidermal junction. And okay, when you see this image, look at the basal layer, it will appear like a tombstone. होता है ना ग्रेव में जो अपना लगा हुआ होता है, that is known as a tombstone. और उसके ऊपर क्या होता है ना, वर्डिंग्स लिखी हुई होती हैं कि this person from birth to death date, that is known as a tombstone. This is the appearance given by the stratum basal in the pemphigus vulgaris, with this kind of the space between the stratum spinosum and the stratum basal. चलो, yes, now here's done. That look at here the blisters. Okay, blisters are present. These are the flaccid blisters, mucosa are in involvement, and the skin are also involved. This is known as the pemphigus vulgaris. When there is no mucosa involvement, only the skin involvement, that is known as the pemphigus foliaceous. What is the difference between the TEN and the pemphigus vulgaris? Because it's almost look like similar, because both have the flaccid blisters with having mucosal involvements and the skin involvement in the both, in the tan and the PV. So what going to happen in tan? In tan there is presence of the crust. Okay, but while there is no crust in the pemphigus vulgaris, in the tan there is a targetoid lesions, while in the PV there is no targetoid lesions. There is no necrotic images. No necrotic skin will be seen in the PV, because in our image we are not able to see any necrotic area, right? And the most important thing in the tan is the history of the drug intake. Okay, yes, definitely here can also be the cause NSAIDs. Okay, so NSAIDs are the things which can cause anything in the derm. ठीक है, dermal disease में कुछ भी कर सकता है NSAIDs. तो जब कुछ नहीं आ रहा, just think about the NSAIDs. Okay, so this one is the tan, and Nikolsky is present in the both while peeling. What is the Nikolsky sign? When you peel the skin, it is easily peelable. That is known as the Nikolsky sign positive. Here the lips are involved with the crustings are present. These are the crustings are present. These are the crusting. Eyelids are involved. Skin are involved with the black necrotic areas. Okay, this is known as TEN. Top. ठीक है. Epidermal necrolysis. Next, let's see this slide here. Two different colors we are able to see. Outer be erythematous, brownish like appearance, reddish brown, and the center you will be able to see silvery like appearance, but not that so silvery. It is known as targetoid lesions. Okay, two zones are present in the targetoid lesions, while the target lesions, what is happening in target lesions, there is three zones are present. Okay, like target eye appearance वगैरह जो हम बोलते हैं, ठीक है. तो target appearance is seen in the three zone and targetoid two zone. Targetoid two zones and targetoid is seen in the TEN. Here you can see this only the two area. Two color you will be able to see na. Dark color in the center and the light pinkish reddish pink colors in the outside. This is the peeling of the skin. These are the peeling of the skin. You can see this. This is the removing of the skin, peeling of the skin. These are known as the Nikolsky sign. Positive. Let's move to the next. Okay. Here you can see this is the necrotic area. Complete skin is peeled off. Okay. This is the example of the TEN. Measures of the TEN. Let's see. There is difference between the Staphylococcus scarlet syndrome while in the pemphigus foliaceus. Pemphigus foliaceus both are looks appear same, but what going to happen in the Staphylococcus scarlet syndrome? Most commonly, children are involved, and the organism is step. Okay, and the pemphigus foliaceus, it is present in the adults. Okay, so yes, you can see this crust, scalings are present. These are the crust and scaling, both have the seborrheic area. These are the seborrheic areas, no? Where lots of gland secretions are present. These are the seborrheic areas are involved. And what going to happen in, because the pemphigus is an autoimmune disease, that's why it will should be F positive. While Staphylococcus scarlet syndrome is due to the bacterial or any other organism. You remember that is most commonly is Staphylococcus staphylococcus. Okay, so it won't be shown DIF positive. Okay, that's why it is DIF negative. Both have skin is normal, but when there is a child, it is SSSS, and when it is adult, then the condition is known as PF, pemphigus foliaceus. Yes, this is not the foliaceus DIF. This is the bullous pemphigoid. Yes. And history of old patients with the traumatic area or dependent parts with the tense bulla are given, that is the diagnosis will become bullous pemphigoid, and it involves the dermoepidermal junction. This here can see this is the dermoepidermal junction. These are the dermoepidermal junction. Here you can see lots of eosinophilia because it's an allergic to found in the old patient. Yeah, tense, itchy blisters, limbs, and elderly patients. And this is about the celiac disease, dermatitis herpetiformis. This is the flower-like pattern-like appearance, no? This one is the flower-like. Ring of the vesicles are present with the central scarring because this is spread like this in the centripetal manner. Take it from the center to the outside, and the center is going to heal and leave a scar, and it will form like a petal-like structure, flower petal-like structure. Okay. This is seen as the linear IgA disease. Pemphigus foliaceus we already done this. Pemphigus foliaceus vulgaris already done. Foliaceus. Now foliaceus, towards the foliation, this is the stratum corneum. I hope you already remember the normal layer: stratum basal, spinosum, granulosum, stratum lucidum, and the corneum. Lucidum is present in only the hands and the palms and the soles, while all other it's absent. Okay, and the pemphigus foliaceus, because it is a superficial blister, it is present beneath the stratum corneum. Okay, तो दिस इज़ द इमेज ऑफ द फॉलिएशियस में वही सेम हिस्ट्री रहेगी. आपको क्या एडल्ट दे रखा होगा, सीबोरिक एंड डर्मेटाइटिस जो एरिया होगा वो इन्वॉल्व हो रखा होगा, डेस्मोग्लिन 1 इन्वॉल्व हो रखा होगा. हियर इज नेक्स्ट इज इमेज ऑफ द bullous pemphigoid. Bullous pemphigoid is elderly patients is around for 60 years old patient की हिस्ट्री दे रखी होगी with lower limbs or any immigration with each condition of the itching, and when you see that the bulla is tensed in nature. Okay, flacid present in the pemphigus. Okay, okay, so the fluid will contain is eosinophils. Okay, this is the normal basal areas, this is the dermoepidermal junction, and here fluid is present. It is usually clear fluid. Okay, sterile fluid. And this is dermatitis herpetiformis. I show you the image of the perifolliculitis area. These are the areas where you can see small vesicles with the inflammation, and the itching is present in that. Dermatitis herpetiformis is present in the celiac disease. Okay. Yes, gluten sensitivity. So there is antibodies present towards a gluten, and IgA antibody or IgA. Comment in the section. Okay. So these are the papillary tip blisters, papillary tip neutrophils are present here. Okay, this is the important. When you see the immunofluorescence imaging, you see in this that the brightness and immunofluorescence will show on only the tip of the red edges. Okay, on the tip of the papillaries. These are the red edges. These are the papillae, and shown the uh, fluorescence on the tips only. That is known. That is definitely an image of dermatitis herpetiformis, because no any other image where you can see this uh, only the fluorescence on the tips. Okay, this is brick-like appearance. Take a dilapidated brick wall, Hailey disease. Various diseases and Hailey disease. We read two. Various disease and Hailey disease. We are going to remember like this. Dutch. ठीक है, इसके अंदर कौन सा होता है? जीन ए इन्वॉल्व एंड Hailey gene C is involved. Let's see some other important images. This is the last image. Let's do the other images. Fatafat. Okay. Acquired condition. ठीक है, acquired condition है, bluish pigmentation है. The condition is most probably of the lichen planus pigmentosus. ठीक है. The most important thing is, while you're saying that kind of a patient, an important characteristic appearance is this. This is known as pup tent nail. Okay, pup tent nail. Whenever you see this kind of image, this is only seen in the lichen planus. Pterygium. It's okay. दिख गया तो कर लो. Pterygium is the folding of the skin comes towards anterior aspect and completely destroy the nail fold. And pterygium for P and P, seen in the P, that is psoriasis. Okay. Let's. These are the fixed drug eruptions. Continuous is मैंने में करता okay. These are the fixed drug eruption. You see this hyperpigmentation on a particular region. Whenever fixed drug eruption means saying this, whenever you're taking a drug, a fixed hyperpigmentation is seen on that area which occurs in the past. Something like a clinical scenario is like a patient having a fever, he taking NSAIDs, and later on after some days he appears with the pigmentation on the lips. He also complained that when he takes same drugs 1 year ago, same kind of a pigmentation is seen on the lips on the same side, not other place, on the same side. Okay, so this is known as a fixed drug eruption. Yes, NSAID is the most common cause of the fixed drug eruption. Let's see the, yes, already done about the lichen planus. Yes, these are the, sometimes here you can easily see this is a bluish pigmentation, but sometimes you won't able to see the bluish pigmentation. You can see this is a bruise like pigmentation, no? Yes, you can see this is a bruise like pigmentation with some normal areas. You can't say this is a bruise because bruise has definite margin and changes with the days. Okay, it's not changing with the days, and the irregular margins with the normal hair. Okay, so these are the lichen planus image. Rosacea. Yes, what I want to say is, look at here, vessels are seen. Okay, nasolabial folds are also involved, and with the some vessels are seen. This is known as the rosacea. That is telangiectasia can be seen in here. Flushing, rhinophyma, pustule, telangiectasia, papules, and the erythematous region you can see in the rosacea. Let's move towards our next image. This image is suggestive of the heliotropic rash. You won't be able to see this. हाँ, इसमें भी स्पेक्टिकल्स बना देती हूँ ना. ठीक है, तो द आईलिड्स एरिया, ऑर्बिटल एरिया इज इन्वॉल्व. दिस इज द हेलियोट्रोपिक रैश इज सीन इन द डर्मेटोमाइटोसिस एंड डर्मेटोमाइसाइटिस. हेलियोट्रोपिक रैश, शॉल साइन, वी साइन, ऑल आर सीन इन दिस डर्मेटोमाइसाइटिस. Juvenile dermatitis. This is a gut red papules. What is this? These are the gut red papules. ठीक है, these are also seen in the dermatomyositis. These are of the SLE. होता है। चलो ऐसे ली, ठीक है। यहाँ पे भी बटरफ्लाई बना लेती हूँ। इसका नोज इन्वॉल्व नहीं है, हेयर नोज कॉन्ट बी एबल टू सी दिस नोज इन्वॉल्वमेंट, बस हियर दिस इज चेक एरियाज इज इन्वॉल्व, इरिथमेटस इन्वॉल्वमेंट, ठीक है। तो these are the appearance with other clinical scenario like ulcer and antibodies or anti-histamine antibodies, depending upon the which kind of SLE is this, but that kind of the antibodies you can see in the antinuclear antibody, anti-DS antibody, and further you have to differentiate between them. These are the same picture of the SLE. देखो, there is a sparing, you can see that there is a sparing of the nasolabial folds. This is a port white stain, है ना, port wine stain. I am saying every time port white, I don't know, ठीक है। हाँ, buff ophthalmos is seen here. Look at here, glaucoma, buff ophthalmos, ठीक है। All are the features is suggesting in Sturge-Weber syndrome. All these are the image. These are the Sturge-Weber syndrome classification, trend-like appearance. Yes, lichen planus we seen it. These are the oral lichen planus. You can see this is the white lacy appearance. ठीक है, with max stria. These are the stria seen in the oral lichen planus. Yes, these are the purplish pigmentation. When you see this, this is a present in the line. ठीक है, lichen planus, what is seen in the lichen planus? Usually in lichen planus there is a hyperkeratosis. Okay, that's why the skin looks like so scaly like and bluish in color. And in cobraneation phenomena, what is going to happen, that if trauma is occurs, if you push the lesion from these sides, then the next growing lesion will be on that direction. That is known as the cobnarization phenomena. Here you can see this. This is in the, here is hyperkeratotic papules, hyperkeratotic papules seen in the lichen planus. Okay. Not so clear, but I want to show here. This is the calavered bodies. Okay, these are the calavered bodies. In further image we see that in detail. Sawtooth appearance. The sawtooth appearance is seen in the psoriasis. Here is lichen planus. You can, these are the civet bodies. Civet bodies is seen in the lichen planus. Hyperkeratosis, you can see this hyperkeratosis, and there is an inflammation and band-like structure is seen here. Okay, band-like structure you can able to see on the image on HP. Pterygium already done. Pterygium in psoriasis. Lichen planus is seen in pup tent nail is seen in the lichen planus. This is the psoriasis. Here you can see this silvery scaly lesion. Here this is the silvery scaly lesion. These are the silvery scaly lesions. When we scratch it, Auspitz sign is seen. Auspitz sign means bleeding capillaries is seen by removing these scales. Psoriasis is due to the PNP. ठीक है, pterygium is seen in psoriasis. Parakeratosis is seen in this. Division of this stratum basal is within the 4 days. Usually it takes around the 4 weeks. Here you can see this. What happened in psoriasis, that during dividing, the cell not able to get mature, and even nucleated cell is present in the stratum corneum, while in the normal thing that is in stratum corneum there is no nucleus is present in the cells, but here is able to see this the nucleus. Okay. And sometimes there is an aggregation of the neutrophils there. This is known as the Monroe's abscess. Monroe's abscess. And look at here the presence of the that saw teeth is of the lichen planus, and here the elongation of the radial ridges and the papillae. These are the gutted psoriasis. Look at this, raindrop-like pigment, raindrop-like papules are seen here. ठीक है, these are the papular squamous disorders. ठीक है, raindrop-like appearance seen in the gutted psoriasis. Here you can appreciate it. These are the things. Okay. These are the staging during the psoriatic arthritis that these bones losing their matrix because of the enzyme. That here you see the pencil tip like appearance, and pencil tip is present in a cup like structure. This is known as the psoriatic arthritis. A specific feature in psoriatic arthritis, pencil in the cup appearance. Okay, this is the pencil tip like appearance. This is the last stage where you can see this. This is the ongoing staging. We already done this. Yes, already. This is the important thing. Look at the nail changes. Here the nail changes are seen in a line. Okay, in a line in a geometrical pattern. This is present in alopecia areata. ठीक है, किसमें होता है ये? Alopecia areata में. Which is also known as autoimmune disorder. Here you see this. There is an irregular pitting of the nails. ठीक है, irregular pitting. P P P and one more P. Psoriasis, pterygium, pitting of the nails, and one more P is. याद करो अपने आप से. ठीक है, थोड़ा तो छोड़ो आप लोगों के लिए. Here you see this is the alopecia and male pattern baldness. Male pattern baldness is जो pattern जो होता है उसके लिए जो staging use करते हैं. The staging which is used for the male pattern baldness is known as the Norwood-Hamilton staging. Hamilton staging. M for male. One meme I want to share with you. I see a video on YouTube reel that him making a ball from this side. Okay, let it be. Let's continue. Look at the pattern from the vertex, and this is the frontotemporal area which is going. This is the pattern of the hair loss. One of the dance teacher has this kind of pattern of hair loss. Now he has this kind of pattern of hair loss. Okay, he's my favorite teacher, by the way. Let's see. This is the female pattern baldness. You see this. In female pattern baldness, usually you see many of the females who divides their hair division from the midline. So suppose this is here. This is a midline, and from this is known as the center, and from center to the periphery. This is the division of the loss of the hair. Okay, in this, and this was known as the Ludwig's staging. L for lady. ठीक है, Ludwig's scale. Okay. Most important about the STDs, these are the small group of the vesicles seen in the herpes simplex virus. In herpes simplex virus, acantholytic cells are seen in the histopathological examination. Okay, these are the image based question asked in the INICT. Okay, Arey Baba. Next, this is the fish of school of fish appearance. No? This is, look at this, fish in a line. Okay, these are the cells. These are the extracellular organisms, gram negative, causing chancroid. This one is the chancre, by the way, where you can see this. This is the dirty area. ठीक है, नॉन ब्लीडिंग, पेनलेस, रबरी लाइक है ना, शॉर्ट एंड शॉर्टी लिम्फ नोड्स आल्सो. ठीक है, रबरी और शॉर्टी लिम्फ नोड्स. समथिंग क्लिनिकल सिनेरियो ऐसे देंगे ना, लाइक कि ना लाइक ट्रक ड्राइवर और एनीथिंग एल्स कम विद दिस, और dirty floppy sign is seen. ठीक है, dirty floor is seen, and not bleeding on the touch, painless sleeping adenopathy, painless ulcer. Then what will be your diagnosis? And it is known as a chancre, the primary stage of the syphilis. The groove sign is seen in the LGB. Okay, LGB, groove sign. Take it. Isthmiosis is like a disfigurement of the female genital organs. Okay, और ठीक है, तो this one is known as the groove sign of the green blood. Okay, here is say this groove sign of the green blood. These are the inguinal lymph node inflammation, and this one is the Popper's ligament. Popper's ligament is also known as the inguinal ligament. Okay. Yes, what I'm going to say, this one is the so vascular in nature, beefy appearance, है ना, beefy red appearance. You can see this beefy red appearance. No, this is seen in the chancroid. It is painful. Most important thing about the herpes simplex virus is herpes simplex causes these multiple vesicles, which first episode is the painful while the other episode is the painless. This one is of the syphilis. Okay, disfigurement, tertiary syphilis, gummatous syphilis. Gummatous syphilis means fibrosis or gumma formation. Gumma like completely disfigure or the normal to abnormal appearance. Okay, this is a tertiary when you don't give the treatment to the patient, and usually what happen, in primary syphilis, the bacteria are present in the lesion, around that lesion, then it disseminate to the blood and reach to the entire body organs in the secondary syphilis. Okay, in the secondary syphilis, you can see that the Ollendorff sign, secondary, so Ollendorff signs. Ollendorff means even this blunt area causes pain on the touch. Okay, and the tertiary syphilis causes disfigurement of the structure. Maybe it's bony structure, obviously. Okay, here you can see this disfigurement of the nose. And one important thing is about the Jarisch-Hexmeyer's reaction. What going to happen when you give benzathine penicillin to the patient? Because of the overload of the syphilis bacteria, they will release. Okay, after the 24 hours they will release and causes the severe painful reactions to the patient and fever. So the patient come to the end, no, I don't want to continue, give me some other treatment. No, you don't have to stop the treatment, you just have to continue the treatment, and you have to give the supportive treatment to the patient. Let's see the, okay, this already has done Colruyt scales and all this. Okay, okay. So this is the end of the video. This is the today's video. Thank you. And still the video is more than this 60 minutes, I think so, but it's okay. Do not forget to like, share and subscribe.